Good evening, everybody. You're very welcome to this, the COVID vaccination in community pharmacy webinar series. This is the third in our webinar series. The first one we covered everything you need to do to complete the expressions of interest for the HSE. The second one was about operations and logistics for doing COVID vaccination. And this third webinar is going to be on the vaccination IT system, which is called HSE PharmaVax. I'm Pamela Logan, Director of Pharmacy Services at the community the IPU, and I'm joined tonight by Claire Fitzell and Alan Riley and Anne-Marie Horan. So just the overview of the webinar tonight is pretty similar to the ones that we've had for the last couple of weeks. We talk about the learning objectives, and then there'll be a presentation from both Alan and Claire on HSE PharmaVax through to how do you access it through HealthMail, how do you set it up, how do you use it, what support's available for you, and then there'll be a little bit at the end about how you schedule or what you need to consider about schedule patients for appointments, and then we'll do some questions and answers. The presentation tonight's quite full, so we won't have a huge amount of time for questions and answers, but if you pop your questions into the wee box there down at the bottom, we'll do our best to get through as many as we can this evening on the webinar, and whatever we don't get through, we'll add them to our frequently asked questions for next week. So our learning objectives are to describe the HSE PharmaVax system. So the name of this has changed a number of times, but at the minute we're going with PharmaVax. We want to know how to get into it, how to use it, how to configure it for all your pharmacy details, how to put your patient details in it, how to record when you've done a patient vaccination, what IT supports the HSE has got that are available to you, and then a little bit about what you need to think about for scheduling your appointments. So before we get into the presentation proper, I'm going to hand you over to Anne-Marie Horan. Anne-Marie has several titles. She is a community pharmacist from Rathfarnham. She's treasurer of the IPU. She's on our executive committee, and she's also on our IT steering group. So you're very welcome, Anne-Marie.
Thank you, Pamela. Good evening, everybody. Since January, the IPU has been engaged with the HSE to deliver an IT solution for pharmacists to record COVID-19 information. The staff in Butterfield House have been working with the HSE team responsible for HealthLink and HealthMail, which you're all familiar with. In February, the IPU's IT steering committee met to discuss how the system will work in a community pharmacy setting, and the IPU committees have been updated on the progress of the system since. The system has a few names. We now know it is called HSE PharmaVax. It went out to 5 IPU members last week for one kind of testing called UAT, and is with 12 members this week for another type of test. This is a pilot. On that point, there's been some misleading media information and coverage of the fact that 15 pharmacies piloted the vaccination program during the week. This is incorrect. It is in fact 12 pharmacies piloting the IT and the operations around it. This pilot will conclude by Friday, by which time we will have a fit-for-purpose IT system ready to go. I want to thank all the IPU committee members and other pharmacists that gave up their time to test this system. This is a testament to our commitment to the COVID-19 vaccination program. I would also like to say that the IPU is an organisation that has been working to progress this program through meetings with the DOH and the HSE and other stakeholders in an ever-changing environment, as we all know. We all know that everyone wants to keep keen to get started vaccinating, so let's hope it happens soon. The IT is arguably more straightforward. I will now pass you over to Alan.
Thanks, Anne-Marie, for that, and good evening, everybody. Before I get started, what I want to say is that these slides, there's a lot of pictures in them, and there's going to be a lot of screens that I'll be talking about here. But don't worry about taking notes, because when I put the slides up on the website tomorrow, we'll have some notes in the PDF with them as well. So don't be concerned about scribbling down too much here. And actually on that point, this is not a training session. You're going to get more opportunities to see this system before you get to use it. So the HSE will probably provide some kind of training in the form of guidance and maybe even a video. You've seen this slide here before a couple of weeks ago on our very first webinar, and I'm just going to talk you through the core functionality of the HSE PharmaVax system, what it does and what it doesn't do. So we know it's here to register your pharmacy for vaccinations and to set up vaccinators in the system. It's about recording the stock that you get into your pharmacy, such as the vaccines and maybe some of the diluents that go with some vaccines. It's about recording patient information, which they call clients in this system. And then it's most importantly about recording the vaccination events themselves. The information that you record in here will also be used for reimbursement, and we'll talk more about that later. What it doesn't do, it doesn't support decision support. So what we mean by that is that you can put information into this system that might not make sense to you clinically, because it's your job to make sure the information goes in is accurate. So it doesn't stop you from putting information that doesn't make an awful lot of sense. So just be very careful on all the screens about the information that you're putting in there. It doesn't support scheduling, so you're going to have to manage the scheduling of appointments into your pharmacy yourself in a different system. One of the other things it doesn't have is a security cert. So you're probably familiar with using security certs for the Pcrs suite or the flu portal. So you don't need one of these for this system. So this offers a bit of flexibility. It means that you can use the PharmaVax system in more than one device in your pharmacy or wherever you're going to be vaccinating. But because it doesn't use a security cert, it needs information security managed another way. And they're doing that through a way called multi-factor authentication. So don't worry about what that actually means. It's called MFA, and it's something you're actually quite familiar with. And we'll talk about that later on in the presentation. One of the other things I want to mention is that you might have seen some COVAX training in HSE Live. So this is not the training for this system. So this is a completely different system. So if you've seen the COVAX system running, this actually looks quite different to that one. There's a couple of terminologies I want you to get familiar with. So the IHI is the individual health identifier. So that's a patient identifier. It's a national patient identifier for anyone that receives care in this country. You're going to see it in the system here. You don't have to do anything with it, but it'll just pop up and it'll be on some of the screens. It's a term you're going to become more familiar with as we move into e-health projects such as e-prescribing and shared care records. And then the last term I want you to be familiar with is MVP. So that's a minimal viable product. And what that basically means is that it's a very basic system, but in a good way. It does what it's supposed to do and nothing else. So this is an information recording system. That's kind of the overview of the PharmaVax system. What I'm going to do next is talk about the initial setup of the system. So HealthMail. HealthMail has a role to play here. You're going to receive your connection, your email to connect to the PharmaVax system in a HealthMail. And the username and password for the PharmaVax system is the same as your HealthMail username and password. You're not going to get sent these details separately because you're expected to know those, and you use HealthMail every day, so it's very possible you do know those, but you might have them saved. What we're going to say is that when you get this in, that you should actually access the system for the first time from the same computer that you access your HealthMail in. Now, there's a couple of things you need to know about HealthMail. You need to know your secondary email address. And that's an important feature, and that's to do with the multi-factor authentication, which I'll explain more on. We were talking to HealthMail this evening, and we know that they're going to send out an email in the morning. And the email in the morning is going to tell you what your HealthMail address is, what your PSI details are, because you would have used those when you're registering your HealthMail, and also what your secondary email address is. And it'll then give you a form if you need to update any of those details. So just watch out for that email, because that's an opportunity to get those details corrected in the system. So that's HealthMail. I'm going to talk next about sign-in and security. So as I said, HealthMail is used to access the system. If you sign into the system for the very first time from the same computer that you got, that you use HealthMail on, it'll make this bit a bit easier. So you won't be asked for a username and password because you've opened it, your HealthMail is already going to be open. But what will pop up is that box that you see there on the top left, which will prompt you. Now, I've got a number of accounts, but you might only have one, which will say HealthMail. And that'll be your HealthMail account, which you'll click and go through into the system. The very first thing you're going to get, and you're going to get this every day you log into the system, not every time, but every day you log into the system, you're going to get asked for a verification code. This is going to that secondary email address. So this is why it's so important that you know what that secondary email address is. And another point is that anyone in your pharmacy that's going to be using this system needs to have access to that email address. So that 6-digit code will come from an address called noreply@hse.ie, and it'll go to whatever address that you use when you're setting up HealthMail, or whatever you set up tomorrow when you get the email from HealthMail. If you're using Gmail, it's going to probably go into the promotions folder in your Gmail account. If you're using another email system, it might go into a junk folder or a spam folder, so just keep an eye out for that. One of the trickiest things that we've noticed over the testing last week and this week is this first initial login, and that's all because people don't know where the email has gone, or because it's gone into spam. So that might happen for the first day, but this is something you just need to find out where those emails are going, and then it'll be smooth sailing after that. Again, this is not going to happen every time you log into the system, but every night at midnight, that code gets reset. So you'll get sent a new code every day that you go to log into the system. It's an important feature just to have information security. The next thing I'm going to talk about is the Dpa and cookies. So let's go to the next slide. When you log into the system for the very first time, you're going to have to accept some of the features of the system. The first thing you need to accept is the cookies. So this is really how the application works. You'll be well used to these on some websites that you might visit where you have to accept cookies. So you need to click yes to that, and then that's how the application will work. Another thing you'll notice, it's actually at the bottom of the screen, at the very first screen when you go to it, is a data processing agreement that you're asked to view and then to agree to. So you're asked to review the data processing agreement, or DPA. Now this is comparable to the terms and conditions that you would have agreed to for HealthMail. It's also probably more similar to the DPA that you have in place with the HSE Pcrs for accessing the pharmacy suite. Now, we in the IPU have actually reviewed this agreement, and it's fairly simple and straightforward, and it's very specific to COVID-19 vaccination information. So you'll review that and accept that DPA, and then you can move on to the next stage. So the system actually walks you through these steps, and it'll bring you through to the next screen, which is about pharmacy setup. So I'm just going to show you the full screen here, which will look different for you because I was just using a test account. So you'll get this screen here, and some of that information will be grayed out. The reason it's going to be grayed out is that it'll have pulled from your HealthMail account. So your PSI number will be in there, and your pharmacy name will be there, and the address will all be in there because that's already set up in your HealthMail account. Now, if you want to change any of those details, you can do by ringing a helpline number, and we'll talk more about that later. Two pieces of information that you'll have to add in at this point, and it's very important that you get these correct, is the PCRS contract number. So your GMS contract number with the PCRS. Obviously, that's for reimbursement. Also, what's needed here is your NCCS code storage account number. Now, we've discovered over the last couple of weeks that everybody's not very familiar with this number. It's not your UDD number. It's actually a 7-digit number beginning with 3. You'll see it on a recent invoice that you might have from the cold storage, or if you have a cold chain account, you can log into the portal, and I believe it's up in the top right of that screen once you get logged into that portal. On that point, if you don't have a cold chain account set up, you need to have one set up, and there's a link to forms for that on our website there. Just at the bottom of the screen, you'll see that. I think I've covered everything there, and I'm going to hand over to Claire, who's going to talk about using the system. Thank you.
Thanks, Alan, and good evening to everyone out there. It's a lovely evening, and thanks for coming along to listen to us. What I'm going to do for the next half an hour is talk through the system, and just to reiterate a point that Alan said, this is not about demonstrating or a training exercise in the system. What we're trying to do tonight is give you an understanding of the functionality and the features of the system, because some of this will play into your operation within your pharmacy and the flow that you will use for your patients or clients, as they're called in this system, in your pharmacy. So the purpose of tonight is to give you good idea of some things that you need to consider when you're writing your SOPs, when you're putting procedures in place. And actually, for those who've been asked for additional questions on their expressions of interest, this will give you an understanding of the administrative function that was discussed in the operational guidance, and why you need to put some considerations into how that will work in your pharmacy. So I'll talk through it. I'm not going to go into every detail of every screen, because when you get the system, what we've learned through the UAT testing and through the pilot testing this week is that the feedback from pharmacists who've used the system says it's quite intuitive. What I'm trying to do with this is also cover off some of the questions that have come back through the UAT and the piloting, so you can understand why the system is asking for the information when it's asking for the information. So just to give you the first look at the system, it is a simple Windows-based system. So again, it will be just opened in a tab along your computer. So you'll have your various different tabs open, like your health mail. This will be an additional tab along with it with other websites you use regularly within your pharmacy. It has a simple menu on the left-hand side, which looks very much like the one on the screen, which is your clients, vaccinations, batches, reports, and vaccinators and pharmacy. What Alan just talked through was the pharmacy details. So they will be set up once you get through that process that Alan's just described. So you won't need to go into that again. If those details were wrong, and I think Alan may have mentioned this, you'll have to phone up a helpline to get those details corrected. So I would encourage you to ensure that you read that email that comes from Health Mail tomorrow and ensure that the criteria they have for your pharmacy is correct. So the 6 different aspects to this, it's not a difficult system. It does exactly what it's meant to do, which is let you record a vaccine, but it is quite different to the flu vaccine portal. So hopefully over the next little while you understand the differences and what it means for you and your operation of this service. So the first thing I want to talk to you about is vaccinator setup. So this again is navigated through that left-hand screen, and I've got a screenshot there. For your pharmacy, you can add vaccinators, and I've got 2 dummy vaccinators on the bottom of this screen. So under add and view, which you see in the left-hand side screen, you add your vaccinator, their name, their surname, their mobile number, email address, role, pharmacist obviously for pharmacies, and your PSI registration number for that pharmacist. Once you click save there, they will then appear in the sub-menu below at the bottom, and then you can put whatever number of pharmacists that you have who will be vaccinating into. So that's one of the steps you can do on day 1. Now, obviously, if you have a local pharmacist that comes in and is vaccinating your pharmacy, they can go in and add themselves into the system, or you can set them up beforehand. But you will need their contact details. The reason why the contact details are in there is this will all feed back into the central COVAX system. So although this is a separate system, they're all linked up. And if another vaccinator is vaccinating a client that you perhaps have vaccinated, they may need additional information about that. And that allows the person to make contact with whoever gave the vaccine in the first instance if they need additional information about that vaccine and what type it was given, if it's not obvious. So that's the reason for that information. And there is filter functions, and you can sort your vaccinators. So I know some pharmacies might have a fair different number of vaccinators in and out over the period, but you can sort and find vaccinators quite easily in that vaccinator set page. So the first thing you do when you get the system is set up the pharmacy as Alan described. Second, set up your vaccinators, and then after that you really will have very little reason to go into those screens. The next screen is batch setup. So I'm just going to talk you through this and talk you through the system and how it's quite different than the flu system. So in the flu portal, the batches and the batch numbers, etc., are already preloaded into the system, and there is sometimes a delay when a new batch comes in and it perhaps wouldn't be on your system in the flu portal. This can't happen with this system because the person who's in charge of entering the batch information is yourselves in the pharmacy. There's a few different reasons for that. One obviously is that we have a numerous amount of vaccines, and different vaccines are coming on stream each time, but also it allows some of the more careful management of some vaccines that have a use by date depending on the logistics exercise as and when it leaves cold storage and comes potentially to your pharmacy. So in this screen here, I've just got the Vaxzevria vaccine. In that name section, it will be preloaded. So the 3 vaccines that are available at the moment are in the system. So you won't have to name this the vaccine. The vaccine type will be in the system. It will pre-populate the marking authorization holder because that will follow the vaccine. What you will need to do when you receive your order from the national cold chain is put in the batch number and the expiry date. Now, for Vaxzevria, the batch number and the expiry date will be as on pack. So it's quite a simple one to create a batch with. And I've just created a dummy batch on this screen here for you to see how it will look. So this allows you to do it. Again, much like Alan said, this is important to get this right before you hit save. If you put an inaccurate information and hit save, there is no way to edit it. Why can't you edit it? It is important that actually every vaccine and every vaccine record stays exactly as it is. So the ability to edit vaccine batches would obviously lead to errors within the system. I'm just going to flick to the next slide just to show how it is different for different vaccines. So in this particular slide, I've highlighted the Comirnaty vaccine, which is the Pfizer-BioNTech vaccine. It has slightly different fields. Now, you don't need to worry about these because the fields are already preloaded into the system. What you need to do is fill in these fields correctly. So for this particular one, it has an expiry date which you need to record for if there's a side effect and you need that expiry date for the HPRA. But in this one, what's really important for the pharmacy is the use before date and time, and that will appear on the packet that comes in from the national cold chain. That's on the outside it. And this particular vaccine has 120 hours from when it leaves cold storage. Different vaccines have different times, and where those times are out in the clinical guidance. But don't worry, you won't need to know about that. We'll send you out absolutely all the information that you need to know what to put in the screen when the time comes and when the vaccine choice has been decided for community pharmacy. But just to let you know, it's in there. It can manage all the vaccines that are available in the market, and what you will need to do is put the batch numbers in as you receive them into your pharmacy. So that is a step that needs to be done when the products arrive in your pharmacy. So plan that in any operational guidance that you will be producing at the moment. I haven't got a screenshot, but just to alert you, the diluent, if the vaccine needs a diluent, you can add the diluent very much in the same way. At the moment in the system, there was only one diluent because there only is one vaccine that needs a diluent at the moment. But again, you'll have to put the batch number and expiry date of that into the system. So that's quite a bit different than the flu vaccine in that it puts you in control of the batch creation. Now, this is the bit that you really need to consider when you're thinking about how your pharmacy is going to run this service. And that's because of the length of time. I know I mentioned this in various other webinars, but I suppose having run vaccination services in the past myself, I know this is something that is going to be something you need to give good consideration to. There is a lot of client information to collect and put into this system. And I'm just going to walk you through this now, and then we'll have a discussion about how best to manage this in your pharmacy. So you've seen this slide before. I showed it to you and I said, don't worry about this. We're going to come back to it. This is the time I come back to this very heavy slide. There is a lot of stuff that needs to be recorded in the system. There's a lot of legal requirements of what needs to be recorded, and the system is built to do that. I'm just going to draw your attention to B, which is the name, address, contact number, email address, ethnicity, pregnancy status, date of birth. All of these need to go into the system. And unlike the flu portal that would pre-populate some of this data from the PPSN number, that does not happen in the system. And that came up as a question quite often in the UATs we've done, and it will no doubt come up in the pilot that we've done, as to why it doesn't pre-populate when you put in someone's PPSN number. There's a very simple reason for that, and please remember this when you get the system and understand this. This system is a new system. It's not sitting on top of any other database. The flu system was sitting on top of the Pcrs database, so it could look for information and draw it back. Whereas in this system, you're starting the database, and then this database looks for the IHI and brings it back. So it's a very different system than what was the flu portal was sitting on top of. So that requires a lot more data entry from you. And that's the bit where in the operational guidance, it clearly asks you to identify your administrative activities. So I'm just going to talk through what does adding a client look like. Now, it's all on one screen, but I've broken it up into 4 different slides just so we can zoom in on some of this information, but it is all on one screen. So not surprisingly, it's looking for the name, address, gender. Now, when you hit gender female, it will ask you the pregnancy status, which is either you tick it if they're pregnant and you leave it blank if they're not. Date of birth, again, you can put it in 2 different ways. You can either just type it straight in, or you can use a little calendar, which I'm sure pretty much everyone's familiar with that type of format from other websites. The additional risk factors are already in them. They match to the national cohorts. The one you most likely will be using is the bottom, which is none of the above, allocation, group and patient age. The system knows the patient's age, so you don't need to put in which group, whether they're in the 55 to 60 or 60 to 69 group. It will do it for you. Mother's birth surname, again, the more information you put into this, the easier it is to find the IHI, which Alan mentioned earlier on. That is not the mother's birth surname is not a required field, but again, the more detail that goes into this, the better. Nationality is important, and then ethnicity. There's a drop-down menu with quite a few options in that, but someone can choose to prefer not to say under that one. The PPS number is pretty much essential, and again, consider when you're booking people in that you have this information. You can tick no PPS number allocated and then give the reason on the right-hand side. I think I talked about it in the last meeting, but if you use and don't collect the PPS number, the payment for the vaccination service will be outside the normal payment process. So you ideally will have a PPS number for everyone that you enter into the system, and it only be a few examples when you wouldn't have a PPS number, and that would be maybe a foreign student who's here, or a foreign worker who has a short-term permanent without a PPSN number. So there's only a very few people who will be presenting who won't have a valid PPSN number. So that's the first section. So quite a few of those fields you need to have that information to be able to save a client. Now, what's slightly different about this system over the flu vaccination system is that you have an ability to save a client at a different time than when they come for an appointment. And this is important when you think about how will I manage some of this administration activity within my pharmacy. So you can save the client down and then at a later stage go back and put a vaccine against them. But you will need to collate quite a bit of the essential data to be able to create a client. So you can't just put the name, address and phone number in and create a client and fill the rest of the detail when they come into your pharmacy. You will need to collect all the essential data and put it into the system and save that client in for later. But that can be something that you can manage when the pharmacy isn't busy, or you use your appointment diary to pre-populate this. So think about how can you manage and use your time most efficiently, so that when it comes to running your flu vaccination service, you're not spending a lot of time on the data entry point of view. So that's the first section in adding a client. The next section, and it's very self-explanatory, email, mobile number. You either have to have a mobile number or an alternative contact number, so one or other, and their error code. There is an error code address function lookup, so if you put in someone's error code, it will pre-populate the rest of the address function. Equally, if you start typing an address in, it will start to try and pre-populate it. So although there looks like a lot of boxes, if you put enough data in, it will start pre-populating the boxes for you. So it's not as much as it looks. GP client information, and I have what's in the legislation in the blue box at the bottom. It's very much in the same way as flu. You need to click to enter the GP information. Again, this has a smart lookup function. So if you type in the doctor's surname, it can start looking at it. It looks at the current register. So pretty much most doctors will be in it. And there is again a tick box for no GP if there's not. At that point, you have 2 options. Save a new, which is adding in a new client. And that's where if you have a booking system or you have collated this data, and I'll show you a form that we've designed to help you do that, you can be adding in or ask a member of your staff to add in the clients and their details into it. Or at the time that you take the person's appointment and they walk into your pharmacy, you could be adding that information and saving it into the system. You can also do this at the time that you actually go to Vaccinate, so you can put nothing in the system. And then when you go to Vaccinate, you can start at the top of this form and then you can hit save and add vaccination. So you can run a continuous process, or you can do save and new, and then you can go back in and vaccinate them at a later stage. So one thing to consider is, how will I manage this in my pharmacy and what will work best in my pharmacy? And I know different pharmacies will be using different systems to collate the data, and I just wanted to show you one system now. We have this booking form, and Pamela mentioned it on the webinar last week, and we didn't go into it too much detail, but I wanted just to go through it this week. We've designed this client detail form, which is available on the vaccination section of our website, to match the particular sections in the HSE PharmaVax system. So it should make the data entry easier. So if you look at the first name, it's in the same place in our form as it will be on the client form. We've got this in two formats. We've got it as a PDF you can print out, and you can ask clients to fill it in or patients to fill them in when they come for an appointment to help you put the data into the system, or you can use the electronic form and put a link on your website. Or this would also be important to give this detail if you're using a third company for your booking, appointment scheduling. This information of what is asked for in the system will be what you'll need to gather at the time that the patient is making an appointment, because it will really help you in managing the logistics of the vaccination service. So it's there and it's available, it corresponds to it, and it should help provide you an additional resource that will support you in adding these clients. Now, a vaccination event recording. So there's two ways you can record a vaccination event in this system, and I'll explain which way to do it. You can either go in through the clients page, which I've highlighted in red there, or you can go in under the vaccinations page thing, which is just there with the little cross. I would advise you to go in through the clients page for a reason. Just last week, this system got connected to the central system, and that means that you get a vaccination history when you enter a client. It should pull back from the central system if someone's had a vaccine elsewhere. This vaccination history, and I've got it up there for you for a patient that I made up, appears at the top of the screen, and then you can confirm the client details are the person in front of you, and then at the end, I've got the grey box there highlighted, you do save and add vaccination. We discussed this, I think, last week, in that you need certain IDs with people. That would be an opportunity that you would check the ID matches the person and the client personal details. So I would advise you to use the client section so that you can see their vaccination history if they have one, and also to confirm their ID. So once you hit the save and add vaccination, you're at this bit of the process. So the next thing you go, and I'll go to the next slide, is you see the vaccinator details. It will default to whoever opened the application. So you have to pick that at the start of when the application opens. But if you have 2 or 3 pharmacists in it and they're using the system, you can either change vaccinator between each pharmacist, or you can open 3 tabs and have different vaccinators at different points. But how you change the vaccinator is just use that blue button at the top of the screen, and then you change to whichever vaccinator you want. So it gives you the drop-down menu of the vaccinators in your pharmacy that you've entered. Then you get to the details. So I haven't got a patient up here, but the patient details will be in here. That's the search function you use, and then the patients will be auto-populated. Don't worry about the code. This is an ID, a string of letters and numbers, which has no relevance. It's just a part of the system at the moment. The first thing you'll need to do in your patient consultation is obviously ask the patient the questions to check the person's medically eligible for the vaccine. Now, there's different vaccines and they all have different forms. Those forms are updated and kept on the immunisation.ie website, and they are updated regularly. So in terms of your operation within your pharmacy, you will need to check that you have the valid and most up-to-date form at the start of any vaccination, and that is something that you need to consider. Now, don't worry, we will let you know if there is any update to those forms when we start vaccinating, but that they are available to draw down. You need to tick that identity has been verified, and there's different ways that identity can be verified. And what I've done there on the screen is just put up the latest way someone can identify their ID, and it's from the HSE and from the Gov website. There's a few different ways. But again, if you're thinking about what do I put on my website, if you have one, these are the type of information that you would put on. as to what someone needs to bring, along with their short-sleeved, loose top, and obviously not to come if they've any COVID-like symptoms. So all of these things are useful when you're preparing for your operation, and useful information to put on any of the patient-facing information you want to use to advertise the service. Consent given. Now, there is a drop-down menu in the consent given, and that is yes, no, or in best interest. Anyone who's done the HSE land training will understand the various different aspects of that. You will either tick yes, no, or in best interest. It won't let you move to the next section of the vaccination event unless you check yes or best interest. And just in terms of date, it will default to the date that is the date. This system is used live, so there really should be no reason why you have to go in and change the date. But it's a system that you use as you vaccinate. But again, you can change the date if that is required. So once you've ticked those boxes, you can move to the next section. So you have to tick that they're medically eligible, and you have to tick that you've identified their identity and that consent is given. And if you don't tick those boxes, it won't let you enter anything into the next section. So the next section, you have to pick the vaccine. Again, the vaccine choices will be the same as in the first menu, so the ones that are available in Ireland at the moment, and then you'll pick the batch. Now, the vaccine batch will be in front of you, so you need to confirm the way you would do normally that that batch is the same batch that you have, and do your double check, and that the date is the date. You put in the batch, and then you put whether it's a dose 1 or dose 2. Again, don't worry, if it's a 1-dose vaccine, it will just have dose 1. It won't have the option for dose 2. And I just want to reiterate a point that Alan made earlier on. This is not a system designed to help you with clinical decision making. You could vaccinate someone dose 1 day after day. It won't stop you doing that, but you have, so when you save this information, you have to make sure that it's correct. You can't then alter it at a later stage. So one double check when you've finished vaccine type, dose correct, and save it into the system. And then that saves to that client record. So, and we'll just go through the flow screen at the bottom there. So you add your client, and you can add your client either before, but you need a good bit of information, or you can add your client as they turn up for their appointment. You select your vaccinator, you record your consent and eligibility, you record the vaccination detail and the administration, and then you monitor your patient. So that's the 15 minutes wait time. And then you issue your client vaccination record. You'll also, prior to them leaving your consultation room, will have given them the patient information leaflet and the HSE leaflet on the particular vaccine of choice that you're using in your pharmacy. That information will all be provided to you from the HSE as part of your consumables bundle that comes into your pharmacy. But it is worth noting that on the HSE website, there is some additional resources for people who potentially are hard of hearing. There's an audio resource that for each of the different vaccines. There is resources for the patient information leaflets that are in large text for anyone who may have eyesight difficulties, and on all different languages. So that will become more important as we work through, and we have potentially different types of people coming into our pharmacies, is that we're aware of all the different resources that will help people make an informed decision about getting that vaccine. So that's how you record the vaccination event, and that then sits in the system against that patient. So if they come back to you for their second dose, you will go into the client screen, pick the client up the same way you would have initially, see their vaccine 1, and then you can confirm when that was given, and it is an appropriate timescale to give the second dose. You're also asked in the operational guidance to book in at the time you give the first dose, the second dose. So you will need to be aware of what the dosing schedule is for that vaccine and when that they should be booked in for their second vaccine. So that's that in terms of the system. And I'm now just going to pass back to Alan, who's going to talk a bit about reports and reimbursement.
Thanks. Thanks, Claire. So I said earlier that this system is an MVP, so minimal viable product. So it's basic. It's a very basic system, and one of the most basic parts of the system is the reporting functionality. There's not a huge amount to it. It's going to report to you on a day-by-day basis who you vaccinated and the information for the clients or patients that you vaccinated in your pharmacy. You can use this screen to then generate your daily audit report. So that same screen can help you produce a daily audit report there's a section at the bottom of the print, what you will print for your name and for the vaccination pharmacist to sign and date, and you can maybe put your pharmacy stamp on that. So that's your record, and you keep that on file. It's also used, the system is also used for reimbursement. So we know that the Pcrs will have access to this information to see your dose 1s and your dose 2s, and then they will be paying you accordingly with your monthly payment in the same way that you would have got your flu vaccination payment. So really that's all there is to say about reports and reimbursement. We'd like to see the reports enhanced over time so that you can have a date range report, so you can put in a number of dates and get a full report for that number of dates. But don't worry, you've got full access to any information that you put into the system, and you can at the moment print daily reports, and then what we'd like to see going forward is that you can print reports beyond just 1 day. Next, I'm going to talk about the HSE support. So what I put up there is just an example of the kind of support that will be provided. This is the kind of material that will be sent out to you as part of the program. And here it's explaining to you about how you access the portal and various ideas around that, various support troubleshooting tips with that there. What you're going to get is a quick guide from the HSE about the various supports that you're going to need. It's going to be really broken into 3 different sections, and you probably will have 3 different phone numbers. So one will be around connectivity and accessing the system. So this is the same phone number that you ring for your health mail. I'm not putting it up here because it'll be provided to you as part of the program pack, but you will be phoning this number if you've any kind of username and password problems, or if you've some kind of issues with connecting to the system. The next is application support. So this is a piece of software that you're using. If it's doing something it shouldn't be doing, or not doing something you want it to do, there's going to be a number you can ring about either something that's not being done right in your system or something that's wrong with the system. So there's an application support number as well. And then lastly, and probably most importantly, is a third phone number, which is kind of your one-stop shop for kind of operational and clinical issues that you might have. So if you have a problem with kind of ordering stock, or if you have a query about some patient history, maybe Claire wants to come in on this one, this is what that number is about. So you can actually ring a number to maybe clarify some of those things. Claire, I don't know if you want to.
Yeah, there will be that one number for all the other queries, and that will be, it will cover a large number of queries. And again, just, I know we are working off the draft operational guidance, but you will have a complete operational guidance when pharmacy start vaccinating, and that will have those helpline numbers in it. But that support number will be things like if you need your clinical waste collected, if you don't have the leaflets that you need, if you have a clinical query in terms of were they vaccinated, they're telling me vaccinated, but I can't see a vaccination history, that one number will help direct you to the different parts that you need to go to.
Thank you. And then lastly, what I want to talk about here, the next slide, is around scheduling and other kind of tips that might help you manage a vaccination program in your or vaccination service in your pharmacy. So scheduling is not something provided by HSE PharmaVax. It's something you're going to need to manage yourself. You can do it a few ways. You can have a paper-based system if you want. You can have some spreadsheets, Excel spreadsheets. We know Refill Assistant have an online system, or actually even an offline system. So they have a software system you can use in your pharmacy, and there might be other providers out there. I'm not going to talk a huge amount about what Refill have to offer because they have their own information on their website, have their website there on that slide. I think they run their own webinars as well, which can give you a lot of information about managing scheduling in your pharmacy. But it's a really, really important part to this and how you're going to manage the whole thing. What you need to do is have a waiting list of patients or clients for vaccination in the pharmacy. What we know has been happening for GPs is that they get an email 7 days or 10 days in advance of a delivery to tell them how many vaccines they're going to get on a certain date. When you get that email, because it's going to work the same for pharmacy, when you get that email, you'll look at your waiting list and you'll move all the appropriate patients for that time period into scheduled appointments. So you might talk to them when you want to confirm them and to be in actual scheduled appointments. Some of the software actually helps you do that and helps you manage that and to move patients from waiting lists into scheduled appointments. What we would say at that point is that once you've got confirmed scheduled appointments and you know that patients are coming in to your pharmacy for a vaccination, At that point, you move their client details into the PharmaVax system. So there's quite a bit of required information that you need to have before you put them into the PharmaVax system. So it's just important you know that you have all these required fields, because you can't part fill these records. You need all the information, such as the PPSN and that kind of thing, to put that in there at that point. Actually, you might be able to add that in afterwards, but there's other information that's required information to put it in there. And one reason for doing that is that when you move patient information into the PharmaVax system, it will highlight to you as to whether that patient has had a vaccination event before. So there could be incidences where you have somebody on a waiting list, but they actually got vaccinated elsewhere. And it's only when you put them into the PharmaVax system that you realize that. So you'd see a record of vaccination against that patient. And that's important, because you can then talk to the patient, maybe cancel the appointment, or maybe discuss what was going on there. It's important to mitigate against no-shows in your pharmacy and wastage of stock, which needs to be avoided at all costs. Claire, I think you wanted to come in here about 12-week cycles and as well.
Yeah, there's a few more tips that we would have found out, and questions that came back from the pharmacists who were doing the UAT and are currently doing the pilot for them. And just thanks to those pharmacists again, the feedback's been really good for the HSE in terms of the usability of the system. And the good news is, guys, is that your fellow pharmacists are finding the system easy enough to navigate. The one or two things I wanted to just talk about is this, and I have a little picture there in terms of tabs. It has been useful for people to open the tabs that they perceive they're going to need on a daily basis along that. So I have a Yahoo, because that was used as a secondary email account in this particular case. We also have the IPU vaccination resources there for you, and then the HSE resources. So the immunisation and the NIAC guidelines will all be things you might potentially open at the start of your day, so that you don't have to go looking for this information if you have a clinical query. A lot of the queries are answered in the Q&A section of the immunisation.ie website, so it is really good to familiarise yourself with those resources before pharmacies will be vaccinating. This, and forgive me if we talked about this last week, I can't remember, but this system can be opened on multiple devices, and when you update the information on one device, it will flow into the other device. So if you have someone who's doing the administration aspect at one part of your pharmacy, and you have a vaccinator in the, say, in the consultation room, the second part, as that person's client details are entered, they will become available immediately to the vaccinator. So that's just one thing in terms of how you potentially will use the service. It will also work across different devices. That's currently being trialled out in the pilots. We'll have a better understanding of what devices it works well on versus which devices it doesn't work well on, but it should work on the likes of an iPad. Again, and I think I did mention it last week, there is a lot of data entry at the administration point, so that potentially sits better with a laptop or with a desktop computer aspect. I'm now just going to pass on to Pamela, who has some other things that you might consider doing in the interim period when we're with the EOIs or with the HSE and before we start vaccinating. So over to yourself, Pamela.
Oh, there I am. Thanks very much, Claire and Alan. So just a few things, like obviously we've just given you a whistle-stop tour over 3 webinars about what it is you need to do to do COVID vaccination, and there's an awful lot to take in. So, you know, there are things that you can do now to start getting yourself operational ready, which is a word that you will hear the HSE using a lot. So there's a huge amount of resources on our website. There's a screenshot of it there. So the first thing I would do if it was me is I'd download the vaccination standard operating procedures. So this is the vaccination policies, not the vaccine specific SOP. So take down those policies and personalize them for your pharmacy, because they're not likely to change. And the frequently asked questions that we have up there, I think it's version 10 at the minute, it'll keep being updated with every question that comes in from the webinars and anything that comes in by email. There's vaccine-specific information on the website, which is useful to look at. So we've got the SPCs and the excipient lists for each of the vaccines. As Claire said, we've got the booking form in there. We've got the legislation, but really you don't need to use that. We've got vaccine-specific SOPs for Vaxzevria and Janssen. You can read them if you want, but don't download them and personalize them yet, because as we know, NIAC's going to pronounce on Janssen next week, and there may be some changes to some dosing things. And I'm in the process of doing an SOP for Moderna as well. And immunisation.ie has got some really, really good materials. Now you'll see in the newsletter every Wednesday, I send you out, oh, here's the updated bulletin and here's some new guidelines and here's some new, so I'll keep doing that every week to let you know, but make sure that, you know, you pop in there now and again and just get your head around what it is. And obviously make sure that all of your training is up to date. And we covered that in the FAQ. So we've had some questions come in beforehand and some questions through the webinar, and we've got 11 minutes because it's a lovely evening and I want to get you out of here at 11 o'clock. So I'm going to whiz through these and Alan and Claire will answer them quickly. Alan, is there any particular browser that we have to use?
Yeah, so that's a good question, and I should have actually mentioned it. There's one browser you cannot use, is what we know for a fact. That's IE11. So everything else that it's been tested on, it works with, but we have been told that it does not work with IE11. So as Claire said, it's been trialed also on iPads as well, and that seems to be working too. It's been used with Chrome, Firefox, and Edge, but we have been told do not use IE11.
Alan, when will that health email come in again?
So tomorrow that's going to go out. Pamela just reminded me today, the last time Health Mail were sending out emails, they didn't all go out in one bunch. So it might take the course of the day for everyone to get that email, but they're being sent out tomorrow. So do keep an eye out for that one.
And one last one, Alan, why does the National Coaching Service not put in the batch numbers and expiry dates so we could just tick them from a drop down?
I might answer that one, shall I? Perhaps. So they potentially could have done that for the Vaxzevria vaccine because it is what it is. The other vaccines that what it goes towards that vaccine will be on the use by date will be absolutely specific to your delivery. So it's not possible to put those in and preload them because they will be different for different deliveries, and everyone gets deliveries at different times. So with that 120 hours that would be in place for the Pfizer vaccine will be different for every pharmacy, and it needs to be entered at pharmacy level.
And I actually had another question. I can continue there about which one is the one that you can keep for 3 months after it comes out of the freezer, and that's the Janssen one. So the Janssen stored in the freezer in the wholesaler. Once it comes out, it's good for 3 months. So the NCCS will change the manufacturer's expiry date on that. Then there's other ones that only last for 30 days, and once they're out of the freezer. So that's obviously what we're talking about. There's different expiry dates for different vaccines. Alan, can you upload as a CVS file from refill assistance straight into the PharmaVax system?
No, you can't. Now, the refill assistant and other systems will be designed in such a way that they mirror the system. So you're going to be taking from one system into another one, much like the forms that we've made available. But unfortunately, you can't just upload into it. Not yet, maybe in the future, but no.
Okay, and Claire, I've got a couple of questions for you around the booking or the information, the gender. Is there an alternative to male and female?
Well, that's a very good question. I don't know. I know it was discussed, and from memory, I'll have to come back on that one. I'm not sure.
Yeah, I think our booking form says other, but I don't know whether we just added that. You talked about if they didn't have a PPS number. What if you vaccinate somebody without a PPS number? Is it just that you have to do that as a manual claim? Is that it?
No, and again, we will get clarity in this closest time. They will look across the board, and that is the PCRS will look across the board. If you have a percentage that is outside the norm of what they expect, they will ask you for details on those vaccinations. Really, it is to ensure that their accurate record is kept. The majority of people have PPSN numbers, and again, the HSE's vaccination website makes it very clear of what you need to bring when you're going for a vaccination event. So again, it's another bit that you can link from your website to tells you what to wear, what to bring, what size to bring. So I would advise members to use that facility of directing people to that website. So it would be the same for pharmacy as it will be for a mass vaccination centre. So what we're asked to bring is the same as what they're asked to bring. In terms of the portal that the 60 to 69 year olds were on there recently, they would have all needed a PPSN number to register in that portal. So it's the same across the board, which wherever they get the vaccine, the PPSN number would be seen as quite essential.
Okay, how's the HSE going to use those expressions of interest to select pharmacies? Are they going to have criteria like remote areas or nowhere near a central vaccination centre? Have they given us any idea how that'll work?
So the moment the EOIs are out, and what the EOIs are designed to do is to make sure that the pharmacies who express an interest can meet that criteria as laid out in the operational guidance. There has been a few members who've made contact with us and they've had some queries back on the expressions of interest. Just to say to any members who've had those queries, if you need support, we're more than happy to help with you. What seems to is that people haven't provided perhaps all the data that needs to give the HSE confidence that you can meet the criteria in the operations guidance. And very much it's just a case of going back with some extra detail and some extra thought. So more than happy to help you. That will be used then by the HSE to look at the number of vaccines that pharmacies can deliver, and then that goes back to the higher working group within the HSE who will make a decision as to when we start and which vaccine will we using.
Alan, there's a question about whether the patient details can be added onto PharmaVax after they've done the vaccination.
There's no reason why you can't do it that way. So you've got a time period to update the national system. So if you want to add those details after the fact, you can. But the PharmaVax system partly is designed to prompt you for certain questions to ask as well. But yeah, you can do it that way. Yeah,
the legislation says within 7 days, but it is designed to be used whilst you do the vaccine.
Okay. Somebody asked about consent forms, the HSE consent forms on our website under patient consent. Back to the EOI, Claire. Kind of questions that people are being asked by the HSE after they put in their EOI is, how do I ensure social distancing will be maintained in the pharmacy after vaccination? What are they looking for there?
Well, I mean, if we think about it, they don't want someone to come into the pharmacy for a vaccination and potentially be at any risk of developing COVID from interactions. So they do need the 2 metre distance. So remember back to right at the start, there would have been the operational guidance in maintaining the 2 metre distance, and the HPSE have guidance as well as the PSI guidance on this, and ourselves have guidance on that. So when you're explaining how they will wait, you need to demonstrate, depending on the number of people you will vaccinate, where they will wait and where that 2 metre distance will be and how they can be observed. So you can't have someone tucked away where someone can't see. If the unfortunate incident is that they would potentially have an allergic reaction to the vaccines. So that's the type of information they're looking for, is where will they be seated? How will you guarantee that they stay for the 15 minutes? And how can you observe them for that 15 minutes?
And does somebody have to actually observe them?
Yeah, someone needs to observe them, and the person who needs to obviously be recognise the signs and symptoms of anaphylaxis and call for the pharmacist who will be trained to treat for anaphylaxis.
And there was a question came in wondering how many cases of anaphylaxis there had been. So the HPRA report, which they issue monthly, came out just this evening, and they've had 9 cases classified as anaphylaxis, all with an mRNA vaccine. So there is for all the years we've been doing flu vaccination, we haven't seen any anaphylaxis, but with these vaccines, there is an increased chance. And the fact that we've had 9 in over 1 million. So that's why it's important to have this direct observation with somebody that's trained. Yeah, so it's necessary. Another question, Claire, how do we create do we create our own contingency lists?
Yes, you do, and it's important that those contingency lists stay within the cohort that's being vaccinated at the moment. They will obviously need to be able to travel to a pharmacy relatively quickly, because the whole nature of the contingency list is, if that vaccine is a multi-dose vial, nothing goes to waste. So you could potentially use tomorrow's vaccinators as a vaccine list as a potential contingency list, and at the time of booking appointments could say, if an early appointment comes available, would you be able to travel here quickly? But you will need to stay within the cohort. So if it's the 50 to 60 year olds, that cohort would need to be the people on your contingency list.
And I'll just follow on from that, and I cannot say it enough that you must stay within the cohort. So there was another question about putting somebody's details in, and the date of birth doesn't match the current cohort, and does it matter that you won't get, is it just that you won't get paid if you vaccinate them? Well, nobody's told us the answer to that, but I look at the Beacon Hospital, who vaccinated people who shouldn't have been vaccinated, and they no longer vaccinate. So stay within the cohort, I think, is the answer. Some people haven't heard about their EOI yet at all. Do you know if there's any date for everybody hearing, or is it just that they're working their way through them?
They're working their way through. I think if they have questions, they will be back to you. I mean, it's the community care pharmacists who are looking after the process, and obviously they have other workload, and they're working through them. So no news is not bad news or good news. It just means they potentially haven't looked at your EOI yet.
Yeah, there's a couple of other questions coming in, and I don't think we have the answers to them, but I'll try and answer them, and then Claire will come in if she thinks she does have the answer. Who decides where a patient is vaccinated? So until they decide that pharmacies are vaccinated and which vaccine we're doing and which cohort we're doing, we don't know that. I know, like, for example, in Northern Ireland, where they do have mass vaccination clinics and GPs and pharmacies, that the patient books with the pharmacy themselves, the GP calls patients and people book for the mass vaccination centre. Whether we'll be doing something different or similar here, I don't know. Do you know, Claire?
No.
No. And you know, that another question was, how will the patient know where they're going? Well, again, that'll be made clear when we get more information. You set a patient up at the waiting time list and then attend another pharmacy, as they can do it earlier. Will that mean that the pharmacy gets the details you entered, or do they have to do it all again themselves?
You have to do it all again yourself. So you won't, any of the information you put in is available to you, but if somebody else has put in records, you have to put that in again yourself. You're creating that record.
Yeah. There's a question there about, should we start wait lists now? No, because we don't know what cohort it is, so you wouldn't know which cohort to do your wait list for. I've one shop and I've 2 terminals open at the same time. No, can I have one shop? Can one shop have 2 terminals open at the same time if operating off-site also? Yeah.
So the fact that you've got this multi-factor authentication instead of security cert means you can open the PharmaVax system on multiple devices, as long as you have the connection details for it, and you can verify who you are, which is the whole point of the verification code.
There's another couple of questions, but I haven't heard back on the EOI. Claire's already answered that, and we're 1 minute past 8, so I'm going to stop there. So listen, thanks to everybody for joining us. Thanks to Claire and Alan and Anne-Marie. I hope you find this series of webinars of use to you, and we haven't planned to do a 4th webinar, but if stuff comes along that we do think that we need to do another webinar for, of course we can. Keep your emails coming into us if there's anything else. We'll update the frequently asked questions to cover everything that we've just had tonight and anything else that we didn't get answering tonight. And thank you very much. Thank you all very much, and good night.
Thank you.
Thanks, good night.
Thanks, folks. Bye-bye.